Welcome everyone. My name is Kath Albury. I'm Professor of Media and Communication at Swinburne University of Technology in Melbourne. I would like to respectfully acknowledge the Wurundjeri people of the Kulin Nation, who are the traditional owners of the land on which Swinburne's campuses are located in Melbourne's east and outer east, and pay my respects to their elders past, present and emerging. And I'm honoured to recognise my connection to Wurundjeri history, culture, country and spirituality through these locations. And we at Swinburne strive to ensure that we operate in a manner that respects and honours the elders and ancestors of these lands. We also acknowledge and respect the traditional owners of lands across Australia, their elders, ancestors, culture and heritage, and recognise the continuing sovereignties of Aboriginal and Torres Strait Islander nations. And I'd like to respectfully welcome all of Swinburne's Aboriginal and Torres Strait Islander staff, students, alumni, partners and visitors, and all of the Indigenous people who are joining us today in this webinar. This is the first of a series of events that I will be running through the auspices of my Australian Research Council Future Fellowship, which has started very recently. I am looking at digital literacies and data literacies in the context of sexual health. And the point of difference, I guess, for this project is that I'm trying to think about what digital literacy and data literacy means, not as an individual attribute, but what it means in an organization or in a community. If we're thinking about literacies or capacities or capabilities around digital technologies or data, how can we think of those in relation to culture? How can we think about them in relation to policy? How can we think about them basically in relation to how organizations think about themselves, or, you know, the way we do things around here? And to think about that in relation to sexual health in the Australian context, at least, I think is pretty new, and in some ways maybe coming a little late in the game, but maybe not. I have the good fortune to be a bit of an outsider in the space of sexual health in some ways, but with a foot in that camp. And so I'm really grateful to be kicking off my research process and 4 years of what I think will be really interesting and exciting collaboration with people in Australia and across the world in such a great company as we have in the panel today. I've been really grateful that Heather McCormack, Jen Power, Daniel Readers and Andrea Waling have been able to join us today to really have in some ways unstructured, in other ways, I guess it's going to be very rich because of the experience of our four panelists, a really provocative introductory roundtable. We're very sorry, Barry Shannon sends their apologies. They are in the nasty stage of a COVID infection today and are coughing too much to join us, and they will join us in a later conversation. I'll say a little bit more about the framing of the conversation today before I hand over to the panelists, but just to give a bit of a context for this event, it is very much a round table. We're going to be very open to questions from the rest of the participants here today. I know the webinar format makes it a little hard to see, but there are actually 51 of us attending today. It's a really diverse group. I'm just scrolling down the participant list. There are a lot of academics, but there are a lot of people from the space of health service provision as well joining us today. And so what we're hoping is we can have a very lively interdisciplinary conversation. The project that I am running focuses on young people, and traditionally my research has focused on young people, but it is not focused at all on school-based sex education or the children. And that in itself, I think, is a bit of a novel thing in the Australian landscape for thinking about sexual health and sexual learning. It is part of the Australian STI strategy to think about young people as a priority population, but often I think in practice, the funding and a lot of the research in this space is channeled into school-based sexuality education. What I'm really interested in this project and why I've invited these great scholars and practitioners is thinking about 18 to 29-year-olds who are in the quote unquote young people category within many Australian sexual health policies, but are often kind of underrepresented in the nuanced conversations we might have around digital technologies and their role in sexuality and well-being and sexual health. I also want to think about what might count as good practice or bad practice or best practice in this space. I'm not asking anyone to dob in any particular organization, by the way. We're not going to drop names here, but the do's and do nots of this space. Obviously, digital health is no longer a novel space, and yet it very often is treated as if it's novelty or innovation. I also want to think about who might be left out of current service provision. I know that the ways that trans people and gender diverse people are included or excluded from the space of public health is a very raw issue right now. I also am very grateful that Heather is here to talk about the Take Blacktion project from New South Wales Health, because thinking about the ways that Indigenous people, Aboriginal and Torres Strait Islander people here in Australia are and are not included in really careful and culturally appropriate health campaigns and also health, clinical health service provision is a very intense question right now. There are real challenges in relation to funding, and we don't know where things will be going after the elections, both state and federal, that are coming up right now. And Heather's practice is such a leader in this space, and her colleagues as well. I'm very pleased that she's here today to speak to that. So that is enough rambling from me. I will hand over to Heather, and I will ask her to introduce herself and to respond to one of my provocations, or maybe both, and I'll just reiterate those for the audience. So my provocations for the panelists were: what kinds of tech are 18 to 29-year-olds currently using to explore their sexuality, health, and well-being? Or what do we currently know about good practice in digital sexual health promotion? And I'll let Heather introduce herself and speak to those questions and hopefully share some content with us.
Thanks, Kath. I'm Heather McCormack. I am a Senior Program Manager at the New South Wales STI Programs Unit, which is part of the New South Wales Ministry of Health. And I'm a Wiradjuri woman. So my portfolio at the STI Programs Unit is a bit of a weird mix. I lead most of our Aboriginal programs, but the other half of my portfolio is kind of communications related things that don't really fit with anyone else's body of work. So Take Blacktion is a sexual health promotion communications campaign targeting Aboriginal young people aged 15 to 29 in New South Wales. And this campaign came out of early findings from research we did at another one of our projects that was based at music festivals. And that research found that Aboriginal young people were less likely to report condom use than non-Aboriginal young people. But what we thought was much more significant was that they were much less likely to report that they thought their friends used condoms. So as we know, these kinds of social norms are a really important influence on sexual behaviour. And shame and stigma are massive barriers to use of condoms and access to sexual health services for Aboriginal young people. So all of this kind of helped identify the need for an Aboriginal-led campaign in New South Wales to empower Aboriginal young people to take charge of their sexual health. So the core components of Take Action are high-profile comedy ambassadors, comedy sketch videos, and activations. And I can usually see some eyebrows going up when I say that, and people are like, comedy? That doesn't sound what we were expecting. But comedy has a really long history within Aboriginal media. We see this really uniquely Aboriginal sense of humour across written fiction, theatre, comedy skit shows like ABC Black Comedy, where some of our ambassadors first hit the public eye. And when it's used effectively, humour can diffuse the discomfort that surrounds sensitive topics. So what I mean by that is that it can sometimes be easier to talk about different topics if you can, difficult topics, if you can have a laugh about them. So Take Action uses this uniquely Aboriginal humour of the comedy ambassadors to kind of get around shame and connect young Aboriginal people to relevant and appropriate sexual health promotion messaging. It's a partnership between the New South Wales STI Program Unit and the Aboriginal Health and Medical Research Council of New South Wales. And the creative is developed by an Aboriginal media agency, and the project is overseen by an Aboriginal advisory group who provide really diverse regional and frontline perspectives. So, great campaign, funny videos. How do we know it's working? We've used a few different measures for evaluation for each of the different components. It's predominantly a social media campaign, so we can look at coverage, reach, engagement, likes, shares, things like that. So far, the campaign has exceeded KPIs on reach and engagement every year that it's run. And our content continues to reach more young women than young men, but we do have a really sizable minority of young men viewing our content, particularly on Instagram. They're just much less likely to engage with the content or follow the page. But that engagement, getting people to engage with sexual health content, it influences those social norms that I mentioned before. Just seeing friends tagging each other and commenting helps normalize the conversation around sexual health. But performance on social media is a pretty easy thing to measure, but we need to dig a little deeper to find out if we're actually getting the outcomes we want in the target audience. So other things we look at are our website traffic, especially completion of key engagement activities. So for example, on our website, we have a service locator where young people can put in their postcode and find a bulk billing doctor or Aboriginal medical service near them where they can get a free STI test. And we would record that as an intention to test. We collect some basic data at the community events that we run, so engagement, resources given out, things like that. And in year 2, we commenced some survey collection with Aboriginal young people in collaboration with the Centre for Social Research and Health. And those surveys formed the baseline of an ongoing evaluation where we're measuring changes in attitudes and behaviours. So the evaluation survey launched at the end of last year's campaign, which was year 4. And it's a longitudinal tool that aims to compare trends in sexual health behaviours and attitudes related to condom use and STI testing. And we're looking at both a cohort of people who were exposed to the campaign and a cohort of people who were not exposed to the campaign. That's a bit about what Take Action is. What I think has made it successful, the most significant factor is that it's Aboriginal-led. It's Aboriginal-led on every level. We have an Aboriginal media agency. It's a partnership with AHMRC. It's an Aboriginal governance group, and the ambassadors are high-profile community members as well as celebrities. The Aboriginal creative agencies have been really essential. They know our audience. They have real insight into how they use media and how they interact with these topics, and they're able to engage them in a really meaningful way. The Aboriginal advisory group, made up of Aboriginal sexual health workers from around the state, have really useful local knowledge and community connections to be able to guide the project. And of course, the ambassadors are really well known and liked. They've all gone above and beyond, sharing the content, attending events, bringing so much energy to the campaign. They are influencers, but they're also, as I said, high-profile community members. So they're involvement and endorsement is really valuable. And It enables people to feel more comfortable engaging with the content and therefore contributing to that normalization of conversations about sexual health. And finally, I'd say the adoption of a strengths-based approach throughout the program of work. Aboriginal young people hear a lot about how disadvantaged and disproportionately affected by various negative things they are. So we made sure that the tone of Take Blaction consistently emphasized community strengths. We don't want to make people feel bad about themselves. We want to challenge the shame and stigma around sexual health and get people thinking creatively about how they can look out for their own health and how they can look out for the health of their partners. So I'm going to try now to share a couple of the videos from the last couple of years of Take Blaction. We did a little practice of this before you guys joined, so let's see if it's going to work. I've got two.
Pox. Crabs.
Chlamydia. Gonorrhea.
Syphilis.
Sandra.
That's me.
Oh, good. Well, follow me.
Go get tested, you mob. Don't make a big song and dance about it.
So that's one, and now I'm just going to do that again. This is not the smoothest process. Here's another one.
Yeah.
If your mom are looking for some interaction, the kind that bring love satisfaction, take a moment before you take action. Play it safe and take Blaction. It ain't a joke when having a poke to risk an STI that can make you folk broke. So take a moment, think of what's words spoken. Take Blaction, be strong for folk.
What are you doing in our room?
Yeah, we're trying to have some alone time. Hey!
Take Blaction. Wait, condoms. Get tested. Get out. Okay.
That was weird, eh?
Catchy tune though.
True, eh?
So yeah, let's take Blaction.
Awesome. Thank you so much, Heather. Folks, I wanted to say to everyone, we will have plenty of discussion and conversation later on. We do, because we're using the webinar platform for Zoom, not the meeting one, we have the separate Q&A box. So feel very free to put questions in the Q&A. But also you can raise your hand when we have question time later, and Paul, who is our fantastic host, will give you access to the mic. Thanks again, Heather McCormack. We will have heaps of conversation about that very shortly, I'm sure. But before we do, I will invite our next panelist, Jen Power, to offer her insights / provocations.
Thanks, Kath. It's a little bit hard to follow that because I feel pressure to be funny, but I'll just go with what I'm going with. So my name's Jen Power. I'm a researcher at the Australian Research Centre in Sex, Health and Society at Trobe University. I am speaking to you from the Wurundjeri land of the Kulin Nations in Melbourne. And I would like to acknowledge elders past, present and emerging from across the country. So I wanted to respond to Kath's question, what do we know about good practice in digital sexual health promotion? And I'm going to speak a little bit broadly about that and probably covering ground which many of us have thought about, but I just think it doesn't hurt to just remind us that the way in which we evaluate or think about or make sense of good practice in digital sexual health promotion fundamentally comes back to the ways in which we understand sexual health or the ways we define sexual health. So I'm sure you're all very familiar with the World Health Organization definition of sexual health, which emphasizes a holistic approach to sexual health as being more than the absence of disease, and uses terms around a positive and respectful approach to sexuality and sexual relationships and the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination and violence. So it's a very broad term, it's a very social term. It refers to, sort of big structural rights and structural freedoms. And it's been noted many times that that definition is quite widely cited in approaches to sexual health policy and programming and practice, but it's a very difficult definition to bring into programs. And most often funding for sexual health programs is quite clinically sort of determined, or it's come through a health organisation or government health department. So often the points that we're trying to address in programming or in evaluation of programs are things like contraceptive use or STI diagnoses or, so-called behavioural changes such as use of condoms or STI screening. And why that's fine, I think it doesn't necessarily capture the breadth of what we're often trying to achieve when we're talking about sexual health or best practice sexual health promotions, particularly in this digital environment. But of course, that takes a much more complex approach. Bringing in that holistic definition takes a much more complex approach. So fundamentally, if we're trying to define good practice in digital sexual health promotion, we do need to think quite broadly. But I do think it's important to articulate what outcomes we're looking for, what is good sexual health, and what do we assume are the changes we might be able to, what are the changes we're looking for in digital sexual health promotion? What do we assume this might be able to achieve? And also, what is digital sexual health promotion? Like, what is the nature of this practice or this intervention or this approach to sexual health? So I wanted to talk about that because at Arches, we recently conducted a study to explore these questions. It was, so when I say we, I mean Andrea and I and some of our colleagues. We were talking to young people, so including people under 18, but also up to 21. So it's sort of slightly younger than the cohort you're talking about, Kath, but I think the issues are still relevant. And certainly we're talking about sexual health promotion outside of the school-based format or forum. So I thought I'd share a few thoughts and insights from that project. Firstly, when we interviewed young people, so for this project, we spoke to young people. We also spoke to some key experts working in sexual health promotion or who are producing digital content for young people. We found that asking questions using the terminology of sexual health tended to elicit a focus on quite clinically based information or information-based resources. So information about STIs or information about contraception or where to get a test, which is fine. But when we asked about sexual rights, and of course, sexual rights is quite intimately connected to, the achievement of sexual health, certainly using that broader definition, we got quite a different perspective. And I guess by asking, I mean, not just asking participants, but also asking ourselves, if we look at the data that we're collecting, what is it telling us about, or what do we see if we apply this lens of sexual rights rather than sexual health? So that helped us to shift our focus from the concept, I guess, to think more broadly about the different forms of online content or online engagements that relates to sexual health or constitutes digital sexual health promotion practice. For example, a campaign for better consent education in schools using an online petition led by a young person, which was very high profile a couple of years ago, is a really excellent example of digital sexual health promotion, or perhaps of the potential for digital media and digital connectivity to support sexual rights and sexual health. And I imagine we could find more examples of the ways in which digital media is being used to support sexual rights in this way, and more examples of where young people, and by young people I mean up to 30, or up, let's go up to 40 for young people, just finding examples of where young people are leading the way in digital forums. And I know, Kath, you've certainly had that sort of counter public health approach and online connectivity in your radar in your past work. And I think if we're talking about kind of research to identify good practice in digital sexual health promotion, you know, we might be looking at questions like, you know, how does something like this, you know, sexual rights campaign actually then go on to perhaps support young people to feel more confident in navigating sexual relationships, or in having conversations about sex and rights, or perhaps, you know, sort of more broadly developing a sense of sexual agency. And then we might sort of understand, I think, more about the potential for online resources or digital sexual health promotion to support sexual health. The other thing we found in this study, well, we found lots, but one of the other things was about the way the online environment supports the development of sexual literacy. So we see in the online environment that, you know, there's simply a really large volume of resources related to sex and relationships and sexual health. And there's a whole range of formal and informal resources or content, and there's a lot of different mediums. So, you know, ads like the Black Nation, sort of short video format ads, TikToks, podcasts, websites, YouTube, through to things like more formal websites, information-based websites and apps. So the sheer volume of information, the different types of resources and content really encourages people to do what you do online and follow rabbit holes, go down the rabbit hole, follow different lines of inquiry, think of different things, you know, seek information. So people are learning online. It's a really excellent forum for people to learn about sexual health. So I do sort of wonder that when we're talking about what is good practice in terms of digital sexual health promotion, actually encouraging or recognizing the way people are already searching for information using digital content is a really important part of that. But the other thing that's come up in our research and other research is the fact that when people go online to learn anything or to investigate, I guess, anything to do with sex or relationships or sexual health, they're rarely seeking information in the abstract. It's quite different to a classroom where a particular curriculum is being delivered. People are usually seeking info that's quite specific, quite relevant to them, or sparked by an issue or a problem or something that's come up in their life, or a question that they've thought of, something that's you know, relevant to their life. So people might engage with sexual health information resources about STIs or contraception or whatever else, but usually people are actually looking for stories that are relevant to their own experiences, looking for people who post similar questions on forums or whatever, or looking for images or scenarios or videos or something that reflects their own life or helps them engage with understanding something about themselves or the experiences that they're going through. And I think this is really important for thinking about digital sexual health promotion, but also thinking about this definition of sexual literacy. So literacy is not just about knowledge of sexual health or what does an STI look like. This might be part of it, of course, but really good health literacy and sexual health literacy is about being able to apply knowledge to one's life. I notice there's a few people in the attendance list who would have heard me go on about this before, but I will go on about it again. I often use the example of the feminist health book that came out in the 1970s, Our Bodies, Ourselves, to talk about the definition of sexual literacy, because I think it's a really good one. So if you're not familiar with that book, it was a book that was written by feminists, targeted towards women, and really focused on sexual and reproductive health. And this book really did teach women about things like contraception, but it also encouraged them to reflect on their lives and reflect on their sexuality and their relationships and reflect on gender relationships more broadly. It didn't just provide info about contraceptions, but although it did do this, it also encouraged women to wonder about what it might mean, for example, for a married woman to be on the pill, what freedoms this entailed, what barriers might lie ahead for them in terms of negotiating that with doctors or with their husbands. So it encouraged thought, it encouraged reflection, it encouraged action, it encouraged agency. So I often think of that as a really good, that book as good sexual health promotion practice for women in the 1970s. And I do kind of think that in 2022, it's possible that digital media is achieving something similar. I say possible because I think it's less clear cut than one book, and the internet's many, many different things. But I do think the online environment does facilitate access to content that encourages that sort of reflection, because people are looking for information that's really specific to their needs, information that encourages reflection, encourages learning about oneself, encourages someone to be curious about their lives. And I'm sure many of you would be familiar with the sort of large volume of image-based resources that have been created by disability sexual rights activists, showing people with physical disabilities in sexual clothing or sexual scenarios, sexualized images, just to counteract this assumption that people with disabilities are not sexual or don't have sexual desires. And I think that sort of resource could be really important for some people in terms of developing sexual agency or understanding their own sexuality, and plays a role in sexual rights. It plays a role in sexual literacy, using that definition of understanding oneself and sort of figuring out how to apply knowledge about sexual health to one's life. So sexual literacy as not just sort of an A on a test or a state of knowing, but about having the confidence and resourcefulness to understand information, to seek information, and to reflect and draw from knowledge. So I think that the online environment actually is doing this to a certain extent. What we need to do is better understand how, and how that connects with the way people feel about themselves, the decisions and the practices in their sort of offline lives, I guess. So research which helps kind of understand the ways the digital environment supports sexual literacy, I think will help us build an understanding of best practice digital sexual health promotion. I've got more to say, but I'm going to stop there and hopefully.
Yeah, leave us in suspense for now. Thank you so much for that, Jen, because we will have a chance to come back to all of these issues. And one of the reasons I'm a bit sorry that Barry isn't here today is I think one of their really provocative conclusions in their recent book was that we've put a lot of time and energy into seeking to reform school-based sex education, and maybe it's irredeemable in terms of helping people understand their lives and their experiences in the ways that you have described there, not because there is not goodwill in that space. There's wonderful goodwill, but there are so many systemic blocks that in fact it may be time to look towards some workarounds in this space. I mean, I know, and I will not go into it now, my colleagues in the Centre for Automated Decision Making and Society and myself, including Joanna Williams, who is here today, are looking at the ways platforms can make these processes quite difficult for organisations that are seeking to work in the online space. We won't have that discussion today.
But the role of explicit content, I think, is relevant.
Yeah, well, it doesn't have to be explicit, unfortunately, to be shut down by content moderation. And that's the question that we're looking at right now. It just needs the wrong keyword, the adult keyword in it. But we will move on to our next panelist. I'm very sorry we can't all be in the same room today for this conversation, especially given how many wonderful people are participating in the audience, but I am super pleased that we're on Zoom because it meant that Heather and Daniel can be with us today. So I will hand over to Daniel Readers. Thank you.
Thanks, Kath, and hi, everyone. I'd like to acknowledge that I'm speaking from the Gadigal land, the Gadigal people of the Eora Nation up here in Sydney. I'm a queer, non-binary person with disability, and I've been a practitioner in HIV and sexual and reproductive health for coming up on 20 years. My first project was way back in 2003, and it was setting up an online community for people who wanted to talk about HIV and sexual health in the queer communities in Melbourne, back when digital was still legitimately kind of a new thing. I describe myself in my bio as a pracademic because I've been a research fellow on 3 different projects looking at hepatitis B, peer-based programs, and the National Disability Insurance Scheme. I'm also a PhD candidate in regulation and governance at the ANU. And I have a real passion for thinking about engagement, and that's what I'm going to have a bit of a rant about this afternoon. Typically, we think about engagement as something that an organisation does, so it's an organisation-centric view of engagement. And in my PhD, I try to kind of mix that up a bit by asking not how do we engage with communities, but how do communities engage in order to reconfigure the regulation of illicit drugs like HIV medicine and illicit drugs like crystal meth. So I have 2 case studies in a digital ethnography of what I'm calling interstitial movements. And they're movements that kind of emerge in an established field of players and try to reconfigure the relationships among them in order to achieve a different outcome for the regulation of the issues they care about. And that emerges out of my interest as a health promotion practitioner, where we're very often trying to engage with what the Australian researcher Michael Hurley called cultures of care. So they are cultures of everyday practice. You might think of the gay community negotiating HIV during sexual practices. And we're interested in the media circuits and the cultural practices that sustain the outcomes of interest in this case. In Michael's era, it was the use of condoms, and in our era, it's the use of PrEP and U equals U. However, when we're talking about engagement, there's a real risk of talking about abstractions, and the abstractions that we constantly use include the term culture, but also the term population. It includes reach, it includes audience. There's a real danger of using this kind of nearly metaphysical language of airy-fairy abstractions that cover over or obscure what it is we're actually dealing with. So I want to make one point 2 ways today. And the first point is from a practitioner perspective, and it's about the importance of organisations maintaining an ambient presence in digital cultural spaces and not just engaging when you have an intervention or a research project that you want to promote. And I can think of a couple of examples, actually 3 examples. I'm thinking of Shine SA, who do sexual and reproductive health work in South Australia. Our Watch, who do work challenging domestic and family violence, particularly among young people. And more recently, the Australian Electoral Commission, of all the institutions, have been doing a really fabulous job on Twitter of participating in what people call the discourse, capital T, capital D, sharing content, engaging in replies, retweets, quote tweets, to really establish themselves as a player in that discursive space, so that when people come to them with a question, they have a brand, they have a following, they have a network of existing relationships that they can call on in order to engage with people and disseminate information. And that's crucial at a time when there's no shortage of state and non-state actors engaging in disinformation, whether for strategic purposes or just for fun. All of these different organisations are engaging on sensitive topics, and they're very conscious of the need to tread that fine line between promoting what they do on a day-to-day basis in everyday language, using relatable, that terrible word, but relatable content on the one hand, and then on the other hand, when they need to, being able to share what can be quite pointed, crunchy material about really sensitive and difficult topics. There's a process of building up trust, not just with the audience, but also with the platform and the algorithm that happens when you're present in those spaces in an ambient sense, and when you're not just showing up because you have a study that you need to recruit for. So now let me make the same point in more technical researchery terms. And I'm using here some thinking from Jenna Burrell and Jessa Lingell that I've drawn on in my PhD research. And they think about a really similar abstraction, a similar problem of abstraction, and that's the notion of the field. So you have ethnographers In the old days, the field was a literal village or community site, and you would show up and you would put down kind of roots, and you would stay there until you had finished studying your project. These days, when we look at digital ethnography, the problem of setting a boundary around the field, of deciding what's in and what's out, how long you're going to be there and when you're going to leave, that all depends on the researcher making decisions. And they propose the concept of networked field studies as a way of thinking through those difficulties. The point they make is that you can't really engage directly with a digital culture except via relationships and circuits that you have done the work yourself to establish over time. And in a digital field site, the only necessary connection between the different objects that you might be studying is often the linkages that you've created yourself as the researcher. And I think that's a really useful way of thinking about engagement in digital sexual health promotion as well. I had the experience last year of working on developing an engagement strategy for the Victorian Department of Health in the aftermath of the 9 Towers lockdown, when the Public Health Intelligence Unit at Department of Health realised that they needed an engagement strategy to rebuild trust with the culturally and linguistically diverse communities that had been affected by the lockdown without any notice and without any wraparound support of 9 public housing towers. So great that they recognised that there was a problem there. And my contact was a very concrete thinker, and I say that in the best possible way. They insisted that we have to think about engagement as something mediated via specific personal relationships, that you can't just talk about the department engaging with the community, that instead you have to be specific about who in the department and who in the community and how are they connected. And I think that's really good methodological discipline. It has been for my PhD, and it is in my practice trying to engage with digital sexual cultures. So the one thing I would note about that, though, is that whereas my friend and my contact working on that project insisted that engagement is personal, in my PhD research, I'm also looking at the network of both human and non-human actors that is implicated when we try to engage with a community or regulatory space. So those non-human actors can be quite mystified in the case of the algorithm that we're constantly talking about, but it can be incredibly mundane. So the login switcher for Google Apps has turned out to be a key player in the chains of association that mediate engagement in my digital field work. Whenever we say, would you open this document here, you suddenly have a Zoom meeting or a Google Hangout full of people going, oh, it says I don't have permission to access that. And then we have a 5-minute conversation about, okay, you're logged in as one Google persona and you need to switch to a different Google persona, and that will give you access to this document. Other very basic things, like as a person with disability, I'm both neurodiverse and I live with cognitive disability. The scroll interface in the Facebook app is a non-human actor that I am constantly wrestling with in my attempts to engage with the kind of materials that I'm talking about. So it's really valuable to think about when we're engaging. It's not just about personal relationships, but it's those chains of association between people, non-human objects, and the different kinds of networks that we're engaged with that really determine whether we succeed or fail in those engagement attempts. So that's my rant. That's really all I wanted to say about engagement. But I'd really welcome questions about how we can practice this differently, and what are those points of intersection between research and practice when it comes to this kind of engagement with digital sexual cultures.
Sorry, I had a few days off work and I forgot how to use the mute again. The non-human actor comes to the fore. Thank you so much. That was amazing. Really thoughtful and thought-provoking, I think. And I will invite Andrea Waling then to respond. Sorry, as an A, I always feel really bad about doing things in alphabetical order because I know, especially when there's a W on the bill. So sorry, Andrea. The next thing I do will be reverse alphabetical order. Yeah, I'm going to restrain myself from responding to Daniel because I would say too much and I want Andrea to have her time to shine. So Andrea, please.
Thank you so much. Just a very quick note, I'm speaking from the land of the Wurundjeri people of the Kulin Nation and like to pay my respects to elders past and present. I'm going to have a bit of a provocative discussion today. To give a bit of a background, I'm a ARC DECRA fellow based at the Australian Research Centre in Sex, Health and Society with Jen, and I'm currently leading a project that's exploring cisgender heterosexual men's understandings and engagements with sex, intimacy, and thinking about sexual communication, consent, and sexual health. So I'm working with a population group that is often not normally a target of sexual health promotion, and for very good reason. And so I wanted to answer the question around what is good practice in digital sexual health promotion for this group. And my answer is it doesn't exist at the moment. And I'm going to kind of explore why that is, but I also don't have an answer as to what we can do. I'm still trying to kind of figure that out myself. So I don't really have a way through it. And so I really welcome some ideas or suggestions or kind of discussion around it. So one of the things that I've been realizing in my work on kind of young cishet men, and this includes kind of work with expert stakeholders that also work with this population group, and this includes policy and practice, sex education workers, and gender violence prevention, groups that work with boys and men's kind of sporting groups as well, is that cishet men have a really interesting visible invisibility. They are so visible in our society. We're very aware that cishet men kind of are dominant groups in our society, particularly white cishet men, particularly able-bodied cishet men. And because of that, they have such a presence that we don't often actually think about them when we think about deficits, when we think about needs, when we think about resources. And that is, of course, for very good reason. It's very aware that there are other groups in Australian society and elsewhere that actually need our resources, that need our attention, that need our support. So what happens is we have a group that seems to be doing okay, that's kind of trolling along, that don't really need any support because they're already a dominant group. And what happens is we're actually missing some really important opportunities to engage them in sexual health. And that actually, to me, has really important implications and consequences. For example, how we're thinking about sexual violence, how we're thinking about gendered violence, and how we're thinking about violence towards other groups that experience at the hands of cishet men. So for example, violence towards queer people, towards trans women who might sleep with cishet men and so forth. So we don't include them. And when we do include them, we have a tendency to focus on very specific deficit areas, such as their pornography use and concerns around pornography use. We look at whether or not they're using enough Viagra. We kind of come at it from a very pathologized place, from a harm reduction place or a violence place. We look at whether or not they've got sex addiction. We're looking at whether or not there's good or bad representations of their sexuality in the media. Or for older men, we're really focused on prostate and testicular cancer, even though young men actually are at very high risk for testicular cancer. So these are kind of the ways in which we think about men. And we've kind of missed some really important opportunities. And some things that I've been kind of looking at in that is that there's a lot of gaps in our knowledge about what we need to do to get men engaged and how to go about it. And some of those include things like we don't really know how men are dealing with unwanted pregnancies. Again, for good reason. Unwanted pregnancies disproportionately impact people who can have a pregnancy over men. They're the ones who are going to have to go through what it feels like to have a pregnancy, may or may not have access to pregnancy termination, may be more likely the ones to have to care for the child and so forth. It's the same for infertility experiences. It's the same for sexual violence. It's the same for accessing sexual health information. Because we understand sexual health information is already constructed within a narrative of heterosexuality, we kind of just assume that men are getting everything they need. And that's actually just not the case. And we know that from the fact that most of them actually, and in the research I'm doing, have no idea how to navigate sexual communication in a really kind of positive and affirming way. They don't really know how to engage in mutually reciprocal and pleasurable sex with women. They don't really understand how to have a difficult conversation about navigating sexual health, whether or not they should talk about using condoms, using birth control, and so forth. So there's a lot of kind of little gaps that we're not really talking about or thinking about. And this is really challenging because it's really difficult to address these gaps but not redirecting resources where they need to go. And that's where I don't have any answer, is how do we address gaps for cishet men without redirecting important resources from other groups that need it. And one example that I've been seeing in my work, for example, one thing that I've noticed in my work that I've been doing with young men in particular is that we have a really large discourse at the moment about consent and consent education. We need to get consent education in schools. We need to get it in digital online spaces. We need to really talk to young men about sex and consent because they don't know how to understand consent. They don't understand what it looks like. They don't understand how to have a consensual encounter, and this is going to address sexual violence. And I've recently done several interviews with young men, asking them to describe for me those sexual scenarios and sexual situations in which they're engaging in consent, in which they're engaging in sexual communication. And they are very aware of what it looks like. They're very aware of what the body looks like when it's not consenting. They're very aware from the minute details of breathing patterns, of the way the skin looks, the way the body reacts to touch. They're incredibly aware. And so that tells me that we need to really maybe rethink this idea about consent education, particularly in a later age, because if they're already aware and still engaging in violations, is consent education actually going to do anything? Or is our approach to consent education actually going to do the work that we needed to do to address sexual violence? And I don't think it's going to, if they're very aware. And the only exception to that are men with neurodiversities that I spoke with. So for example, some men who talked about their experiences of autism had a very different experience of that, and that they very much needed the verbal confirmation of consent during a sexual moment. But for those who identified as neurotypical, they're incredibly aware. So that's why I'm very cautious about some of the approaches that we're talking about now to try and get men engaged, because I don't think they're going to do the work they're going to do. On the other hand, I do think there's some things that are starting to happen that are being effective that we need to think about. So for example, in the 2009 to 2018 National Update on HIV, viral hepatitis, and sexually transmissible infections in Australia by the Kirby Institute, it noted that there was a 300% increase of reported syphilis infections among cisgender women. And that suggests an increased heterosexual transmission. And so while we know that syphilis can be transmitted between women, it's a much rarer occurrence. And what I found when I'm talking to expert stakeholders about that, as I said, well, we don't really talk to men about STIs or STI transmission. We don't really engage with them about it. We kind of just say use condoms. But most contraception, most reproductive, most kind of sexual health stuff around the use of condoms is based in contraceptives. So it's based in reproduction and making sure you don't get your partner pregnant. It's not really, it's still kind of not really based in an STI framework when we're talking about cisgender heterosexual relationships. And so what happens then is that the burden of responsibility of contraception still falls on women. And that's also from a long history of control of women's bodies around the use of hormones, around kind of controlling their capacity to get or not get pregnant, which has had, amazing leaps and bounds in terms of rights to liberation and bodily autonomy. But the downside means that men don't hold responsibility at all for contraception, and they're continuing to not hold it. And the men that I spoke with in my study, they often just assume that she's on birth control and then they don't use a condom, and they don't even think about STIs. They're not thinking about STI transmission. They just assume that if she says that she's clean, and I hate that language, but if she says she's clean and hygienic, then as long as she's on birth control, we don't care. And that's a real concern. And I think where something is working is that we know that in 2013, HPV vaccination was included for cisgender men that could take it. And that actually was seeing a really important reduction of HPV and genital warts diagnosis among this population group. And that's really important, because if we're seeing a decrease in diagnosis among men, particularly men who have sex with people with a cervix, that actually has potentially really important implications for people with a cervix, of a reduction of that STI and the possible development of cervical cancer, which is a very serious development. So when men are not really included, or when they are included, there's a lot of uncertainty. And in a lot of the research, we know they're also not really learning about how to have sex. We know that RSC isn't really doing that kind of job. They're looking to pornography. Some pornography can be really helpful into showing them bodies and providing reassurance. And as we know, some of it is not. Some of it can be very violent and may not actually demonstrate the kinds of sexual activities that they want to engage in. And I feel like I'm kind of going on a little bit of a rant and kind of have lost my place a little bit. But I think what my point is that gendered power is still very much present when we're talking about this population group. And I don't actually have an answer. Is how do we have effective engagement that is effective and is doing the work of sexual health promotion, but is also actually addressing some of the kind of greater, bigger gendered power things that sit underneath what it means to be a cishet men engaging in sexual relations with women or with women with trans histories. What does that actually look like, and how do we address that? How do we shift the conversation and narrative to make men responsible for contraceptive and to take responsibility for contraception? How do we shift the narrative that they're having those conversations with the people they're going to have sex with around safe sex? How are we going to get them into testing? Because they're often the least likely to go get tested, and they're the least likely in clinical settings to be asked to be tested, because there's less of an organic opportunity to actually talk to them about, well, you're here, you've got a cold, why don't we go and get you tested? Is a very different conversation to if you've got a young person, for example, who experienced menstruation. They might be going to get access to birth control, and the doctor might say, oh, are you interested in getting some sexual health testing as well? There's a lot of kind of discrepancies around that. So yeah, I think that's my main point, is that I think when working with this population group, there's a visible invisibility, and I don't know how to address it, and I don't know what that looks like for good sexual health promotion, but I think we need to start, and we need to start in a way that continues to lift up other groups and population groups that actually really need the resources, need our attention, need our support, but we can't leave this group behind, even if they are a dominant group in our society.
Awesome, thank you. And thank you, Andrea. You were not off topic at all. That was great. Thank you to all the panel. We've got some comments in the comment thread. I'd like to invite the people who are here with us today also to put a question in the Q&A or ask a question by raising their hand. If you raise your hand, Paul will put you on mic. So I'll let you have a little time to think about that now. Can I ask first, though, does anyone on the roundtable panel have a response or a comment or a question for any of your fellow panelists? It's like, oh, now we're on the spot. Okay. Well, in that case, I would like to kind of do a little reflecting. As I said, my project that I'm taking forward, the selfish reason I've invited everyone here today, and I have been soaking all this up, and I'm really looking forward to going back to the transcript again after this presentation, and both the transcript and the recording will be available after this presentation, subject to the roundtable participants' approval. One of the things that really interested me in my project was what I saw as a kind of fade away in conversations around sexual health. And that's why I appreciate, Andrea, that you really pushed that to the fore. The increased rates of gonorrhea and syphilis in Australia, it's just unthinkable to me that this is happening now. And, you know, I know there's a pandemic on and we've got other stuff to think about, but I wonder why there is so little focus on sexual health right now outside of sexual health organizations themselves, which, as we know, are kind of sketchily funded and very much on the front lines and kind of lurching from project to project. We've got a question from the group. I'll leave that kind of observation there because I'm as kind of outraged and bemused as you, Andrea, on that point. There's a question from the audience. How do we encourage research that is not just extractive, but also empowering, in that participants, I should say, also directly benefit from research. I know many of you have done that kind of work. So I'll invite anyone to respond first around research practice and partnership that benefits participants.
I'm happy to have a stab at that question. On some level, I find that a difficult question to answer without falling back on the really obvious things that we all sort of say about the importance of community leadership and community participation. And certainly in the HIV sector, we use the language of meaningful involvement or meaningful engagement of people living with HIV in research. And I think that's a really important term. Like what does it mean to have meaningful engagement? Sorry, I just realized I've got a loud heater in the background. You know, meaningful engagement or meaningful involvement of community isn't just about consulting, you know, on the survey design or consulting on how to promote the study. It's actually about understanding and I think valuing different forms of knowledge. So really understanding and appreciating that people from a whole range of different experiences bring important knowledge to bear on a study. So actually, you know, bringing a whole range of voices to a table means you all learn something and that your study improves and is better as a result. It's not just consulting community for the sake of, you know, the politics of it, or to you know, show or demonstrate that you've consulted with people, but actually researchers understanding how much their project can be improved with different insights and experiences. And also sort of, you know, trying to, I guess, locate research questions around, sorry, I'm going to go on a little rant as we keep on saying, I think it's a tricky question, because often if you go in and say directly to, say, a community organisation, what are your immediate needs? They'll be able to talk about program evaluation. They'll be able to talk about what sort of informational needs they require to support advocacy or funding submissions. And all of that is really important. But I also think there's a role for researchers, and you know, and I think we see this again, drawing from the HIV epidemic, or the sort of research response to HIV. There's a role for researchers in really pushing thinking. For example, pushing thinking around, you know, what public health or health promotion or sexual health promotion might be. So if you look back to the history of HIV, we had these amazing researchers in Australia who introduced this idea that public health research was about understanding community, was about understanding connection, was about understanding some of the things Daniel spoke about before, such as, you know, networks of care, the way in which people look after each other, the way in which sexual networks, in this case, particularly of gay men, were about promoting ideas or promoting conversations about use of condoms or sexual health. And those networks were key to shifting cultures so that safe sex was normalised. So what those researchers did was sort of shift the way we approach public health research in general to being a sort of humanities focus, a community focus, not just a clinical question. And that, I think, continues to be really important and really relevant. Sorry, I hope I'm not losing you. I think my point is, I don't always think it's really obvious, and I don't want this to sound like I'm saying, well, you should trust the researchers, they know best. I think there are many questions that might end up in the long term being really important in terms of things like funding more creative approaches to health promotion. But they might not be the obvious, this is what we need in the immediate moment questions. Does that make sense? The whole point is it's a much more complicated question than I think is immediately obvious once you really delve into it. Daniel, can you jump in?
I can. I'll be really quick because I would love to hear Heather's perspective on this as well.
Yes, as I was thinking of what you said about constituting your campaign. So Heather, so I'll Daniel and then Heather, thank you.
I work at the National Association of People with HIV Australia, which is one of the main clients, as it were, of Jen's research on the Futures study. Futures is a study that happens every 2 or 3 years, I think, of all of the people with HIV in Australia. as many of them as it's possible to recruit. And we realised at NAPWA that we were missing a key group in that study sample, and that was positive Asian Pacific Islander men primarily, but people generally. And so I think that my initial answer to that question of how do you ensure that research is not extractive is you need to have people in a position to be a little bit difficult when the moment calls for it, to get in a researcher's face and say, in this case, it was a very polite conversation with Jen saying, hey, here's an issue. Could we address this with a different sampling and research data collection method? And Jen, being the wonderful person she is, immediately saw the problem, and through a network called the Positive Asian Advocacy Network Australia, began recruiting for in-depth interviews, people from that undersampled group. So you have a group that's too small to make much difference in a statistical analysis, but that meant that those in-depth interviews were infinitely more informative than what we had before about the needs and experiences of that group. So it's kind of a success story of identifying where research was missing a kind of key population that we thought it was really important to reach, and a really nice collaborative partnership for addressing those gaps. So to come back to the point that I'm making, if the community can't make life difficult for the researcher, then it's probable that there isn't meaningful engagement. And I'm not going to name them, but I can point to surveys that haven't changed their methodology in the past 15 years. And they're really just generating the same results year after year after year. And they're still missing out on those key populations whose experiences and needs are not represented. So yeah, that's kind of my question as a practitioner is, are the researchers willing to be vulnerable? Are they willing to let you come in with difficult questions that make their lives in a methodological sense a bit more difficult in order to ensure that the full diversity of the population is represented?
And I think, are they willing to turn up? Ambient presence and building really long-term relationships are really relevant here too.
Fantastic, thank you. I would really like to hear from Heather, because you really carefully stepped us through the way your campaign was constructed, and it seems very carefully put together in terms of engagement, and I'd love to hear some more about that.
Sure, I do have a bit of background noise going on, so I hope that's not too oppressive. On research, so this is something we hear a lot. Aboriginal communities are heavily over-researched, and a lot of them have really bad relationships with the entire concept of research. And it's something I hear a lot from non-Indigenous researchers saying that the non-Indigenous researcher is researching Aboriginal people as a study population, investigating a question that the Aboriginal researcher wants to resolve, and how can they more meaningfully consult with Aboriginal communities to, make their research more culturally appropriate. And I would argue that there are, several false assumptions in that line of thinking. It might be a radical position, but I'd say we need to reorient entirely so that research about Aboriginal people and communities is Aboriginal led and focused on Aboriginal priorities. We so frequently see the meaningful Aboriginal engagement being consultation with advisory committees or organisations, or at best you've got Aboriginal people engaged as peer research assistants. And while I think all of that is very valuable, often non-Indigenous researchers can't really answer the question of why they haven't engaged Aboriginal people on their own level. There are Aboriginal researchers, we're all over the place. I think Aboriginal research needs to have Aboriginal leadership, and part of that is like a really kind of radical shift to get non-Indigenous researchers to think of Aboriginal people not just as data points and stakeholders, but as colleagues and experts. And I think when people are consulting the Aboriginal community as experts and colleagues and potential leaders in the research field, rather than as an exercise to get through ethics, that's the only way we're going to see meaningful change on this front.
Awesome. Thank you so much. We have another question from Caitlin McGrain, which I will read out for people who can't see the Q&A. And it's long, so I'm going to kind of cut to the question-y bit, but there is awesome praise for you in it, Andrea, also. Andrea, it's a question about your interviews. So you say that the men that you spoke to kind of knew about consent already. Did you get the sense that they were open to learning more, or did you suspect they were telling you what they wanted to hear? I'm about to start a project working with, looking at online harassment, working with young men. I'm thinking about how I talk to and work with men and boys, thinking about problems that, as you say, are deeply imbricated with gendered power.
Yeah, it's a really tricky one, actually, working with men in any of these spaces. The way I actually approached the interviews was I had them describe to me an encounter, a kind of step-by-step encounter. And through those descriptions, I asked them to tell me about the feelings associated with them. I asked them to describe body positions. I asked them to describe, how did you know if she was enjoying it? How did you know if this was working? What was the kind of signal for you? And then I asked them to describe what was not enjoyment, or what was not a signal. Mm-hmm. So even if they were telling me what I wanted to hear, that still tells me that they know what it is. And I think that's the sticking point, is that it doesn't matter actually in a way if they're just kind of repeating verbatim. It means they have the knowledge. And so if they have the knowledge, whether or not they're engaging that in practice is the other question. And I have to go, I don't know if they're actually engaging it in practice. I'm not in that moment with them. There always has to be a bit of a disbelief around it, or we have to decide, are we going to believe them on their terms, or are we not going to believe them on their terms, which is a whole kind of methodological issue to deal with when you're working with anybody, particularly cishet men in the space of gendered power, of sexual violence, all of that. But you kind of have to go in, if you go in with the knowledge that if what they're telling you, regardless as to whether or not it's what you want to hear, they still have it. So then that means that they know on some level what, like, right or wrong, for example, is, and whether or not and then we know on the other side of that most women, for example, if we're talking about women, will have experienced the wrong side of that. So you kind of have to make those kinds of connections. In terms of learning more, they were interested in learning more. If I asked them questions about sexual health around, some of them didn't even know what HPV was. They had HPV, sorry. Yeah, HPV, sorry. HPV is a forestry plantation. They didn't know what that was. They didn't know you could get a vaccination for it. They didn't really have much knowledge around STIs. They didn't really know much about birth control. They kind of just thought all women had to take it. Like, I had some men who didn't even realize that some women didn't take it, and they didn't have an understanding as to why you might not choose to take it or the impacts of it. They didn't understand the side effects. There's a lot of stuff they didn't know that they were open to learning, but when it came to communication and consent, they were very, very articulate about exactly what is a consensual encounter and what isn't. So the real question isn't whether or not they know about it, but actually, what are they doing in that practice? Are they choosing to ignore signs of rejection, to ignore signals that might be nonverbal, which I think is what's happening. Sorry.
Yeah, it takes us, and we won't rant on this, but Daniel and I have had many fist shakings around awareness campaigns in the past, because it's very clear in this area, as in many areas, that the issue is not awareness at all.
It's quite a confronting thing to think about, though, isn't it? Like, I feel like the answer that the problem is that they just don't know, and if we educate them, then that will fix it. Like, that's kind of a comforting idea. And it's quite confronting to realize that we might be looking at something much more complex and a bit darker.
And it's also, I think, in a way, also reproduces the inherent unequal power dynamics within that. If we continue to frame men as not knowing or needing educating, then we're not holding them actually responsible. And that's what we need to do. But that's not what's happening. We've just shifted into, oh, we need to educate and they'll be fine. They're still doing it.
Yeah, I worked as a researcher on one of the Victorian government inquiries on sexual offences law reform in the mid-2000s, and that was not a life-enhancing experience by any means. But it was really clear even back then that this account of accidental rape, of cis-het men not knowing what they're doing and not being aware of the possibility of their partners not consenting to sex, was the dominant way of explaining the majority of sexual assault. And that's a key defence, so it shows up a lot in legal cases, in prosecutions for sexual offences. But so it has kind of taken over in public discourse as the main explanation of why sexual assault happens. And it points in this really misleading direction towards sexual health promotion and sex education as the ways to stop rape. Whereas if we follow the more holistic definition that Jen presented, then they're really important as ways of having better sex, but they're probably not the key mechanisms that we should be looking at for sexual assault prevention.
Yeah, exactly.
Great, thank you. I will just say there's about 10 more minutes, folks. So if you are a participant who's not on camera and would like to ask a question of the panel or offer a reflection or provocation of your own, now is the time to please pop your hand up or put a question in the Q&A. I'm going to slightly shift back a bit to, let's make it about me again. I'm going to slightly shift back a bit to the topic of the Future Fellowship, which is less about what we might teach outwards from a sexual health organisation or a clinical service or a research organisation, but what we might learn ourselves as researchers, as clinical practitioners, as sexual health promoters. The question for my project is, what does digital literacy look like within a sexual health organisation, rather than, and this question, I should say, arose from collaboration with some great organisations here in Australia over the years as a researcher, sometimes working on the development of campaigns or advising on the development of campaigns, sometimes in other kinds of conversations, but a sense that for many organisations, digital culture seemed like a scary or novel thing that was happening out there. If someone in the organization knew anything about it, it was because they were the young person who'd just been hired and they were supposed to be the embodiment of knowledge because they were the so-called digital native, as if such things exist. There was very much a sense that the organization's perspective was that this was a site of risk. If there was a social media policy, the policy around social media was about, conduct and reputation and not bringing the organization into disrepute. It was not about the kind of ambient presence and the role of the organization as a participant in digital culture that Daniel spoke about so compellingly. I see we've got another question, so I will follow up with that in a minute. But I wonder if each of you might give a kind of brief response about how you see your the kinds of insights that you've offered today reflected back or reflecting in the research and practice cultures that you're engaged in? And I know, Heather, you're very much engaged in digital culture in your work, so I might ask you to go first.
Sorry, I was reading what the question was and I got a bit lost.
I was thinking about how does your what is your sense of the ways that health organizations or health promotion organizations understand their own digital literacy in this space?
Yeah, so this is a bit of a complicated one for me, because while I work in a leading sexual health organization, it is a sexual health organization that is part of government. And there is a level of risk avoidance that comes with being part of government that to an extent non-government sexual health organizations can distance themselves from a little. So I mean, for example, with the Take Action Sister Project, Play Safe, which is our youth program that's targeted at a mainstream youth audience, we got memed. We ended up in a bunch of Jimmy Ree's content, kind of meaning about how ridiculous it is for the government to be telling you to have sex. And that's obviously something that is very much on the minds of the people who are approving all of our content, approving our strategies, approving the ideas about everything we want to do. So we have to be really clear that everything that we're putting out has a really clear health message attached to it, so that we can feel confident that the people who have signed off on it are not going to come back to us and go, well, why did you put out this content that's obviously just about sex and not actually about STI testing or condom use. And we've had some luck in recent years about weaving some content in that's focused more on healthy relationships and female empowerment. And we did that in direct response to comments by young women made during our evaluation. But there's still, like, we have like a fairly strict set of criteria we have to meet in order for our content to be endorsed. And sometimes I look at the sexual health content that's being put out on social and digital by some of the NGOs or some of the peer organizations, and I'm just like, oh, I would love to have the freedom that you appear to have with your messaging. I feel like we're very lucky with Take Action that the incredibly positive response the campaign has gotten and the strong feeling of ownership that the community has over it has meant that we have a bit of flexibility that a lot of government campaigns don't have. But yeah, so that question about sexual health organizations' use of digital communications is a little complicated by the overshadowing government context for me, but yeah.
Maybe the digital literacy is the organisation having to understand things like being memed is part of the game, part of the process, and you've got to relinquish a little bit of control there for that, for its effective, actually.
And I guess it's that the people who are making the content and deciding that something can be briefed for approval, we have to have a good enough understanding of the digital context that our users are existing in to know that if we get called on to provide a rationale to the health minister because something has ended up on the front page of the Daily Telegraph, that we can do that in a manner that provides adequate rationale and justification for the decisions that we've made and they've signed off on.
Yeah, great. Thank you very much. That's really, very, very succinct and very much pointing to one of the big issues in Australia right now, that funding issue. And I was recently involved in a project where we were writing the evaluation and we were saying, oh, well, can we say it's a great thing that we didn't get stoner slothed? And it's like, we didn't get stoner slothed yet. Let's just wait and see. Because yes, being memed is I would say, part of the terrain. Daniel, you've got your mic on. So I wondered if you had a follow-up comment.
Sure, that is entirely accidental, but I'll have a crack. I've been the young person a very long time ago who was assumed to be a digital native, and it's a terrible model because you take a person who is structurally disempowered in every possible way and then tell them that they're responsible for this thing that could be mission critical to the organization. The advice I would give these days, talking to program managers or organization managers, is you need to hop on TikTok. There is no substitute for getting your feet wet in the digital spaces that your organization is going to be operating in, and just getting a sense of what's normal, what the possible risks might be, how people manage those risks when they eventuate, and kind of take it from there.
That was beautiful. Thank you. You gave the actionable advice for the manager there, which is that is the sign of your 20 years of experience. It's so appreciated. Thank you. Look, thank you everyone for a great chat. I really do pine for the olden days where we would be all in a room and say, you know, maybe we'll go and have a lovely mocktail or a glass of wine now and talk some more in an informal way. I do hope the day will come when we can all be in a room talking about this informally. And to all of you who've joined us in the webinar today, thank you very much. We really appreciate having you here in the sidebar that you are, the list of names. We could have talked a lot longer here, I think. It was a wonderful group of panelists and everything that I could have wished for as the first formal event for this 4-year project. Thank you very much for coming today. We will have future events. People who are here today, we will share updates, and yes, there will be a recording of this event and a transcript once I check the AI version of the transcription for accuracy on the Centre for Automated Decision Making in Society's YouTube channel in a few days. So please, let's do the virtual Zoom applause for everyone here today. Thank you, and I look forward to seeing you all again.